treatments. Now, a little higher up is that, especially if they have a history of bladder, vaginal, prostate, the guys, the older men, they've got prostate problems. This is a wonderful remedy, the Shvita 1 and Vita 1 and Vita 3, wonderful for prostate. But, it often will stir things up a little bit. The other one with this one is in guys, it often brings up emotional stuff about not feeling, they feel a little bit more unstable. So in some of the older, especially older women, if they're pretty yin kind of body types, they often are a little bit more unsteady. I mean, that's one of the indications for that particular group is, not grounded, not steady on their feet, so physically, emotionally unsteady. And occasionally they get very short-term flare-ups of that. If you're looking at a lot physically in the older ones, you want to make sure their B12s and stuff are where they're supposed to be. Prostate, vaginal, if they have, a history of old infections, old abuse. Shvita 1's a great one for people who've had trauma to that particular part of the body, male or female. And when you first start, if it activates some of that, they can get some interesting anger, some interesting sadness, and some of them will get actually, like a bladder infection out of the blue or a vaginal infection out of the blue. It's very mild. Or, the guys, if they got a little bit of benign prostatic hypertrophy or they got a little prostatitis, they may get little flare-ups. And, it's a matter of treating it appropriately if it's infection, if it's yeast, if it's bacteria. There's lots of remedies and stuff that work for that. Shvita 2. This is a little bit higher up, sort of belly button to pubic. So in women, it has a lot to do with reproductive hormones. It has to do with a lot of relationships, more physical-based, intimacy, lower back, some of the bowel stuff. So any of those things that, especially if they have a history, that don't be surprised if you see a little bit of a flare-up. Now, remember, it's rare, but if they're going to have a flare-up, those will be the areas that they do. And again, energy, working, if they're menopausal or perimenopausal, you're more likely. I had one woman who, hadn't had a period, had gone through menopause relatively easily, hadn't had a period for, a year. We put her on it, and all of a sudden, she was menstruating. So we sent her to get checked to make sure there wasn't anything else going on. But it was just that there was a block in the energy, and we started moving it. And she also discovered all sorts of other interesting things about her relationship with her partner, and we understood a lot of why things hadn't been very happy down there for a long, long time. So in areas where there are chronic physical symptoms, almost always there's chronic mental emotional. We know that. Low back, amazing number of people have low back stuff for no apparent reason. And a lot of times it's energy. And, they've got too much load on themselves. They're pushing their adrenals way too hard. Chakra 2, Shvita 2 stuff, you can get a little anxiety. That's probably the biggest one on the emotional one for that one, is just anxiety. And the neat thing is if that happens, you can test them if you haven't already for the Anxavita or the Simvita. The Anxavita being one of the acute remedies for anxiety, which is mostly mental, emotional, but not very much physical symptomology. So they're getting anxiety, but they're not getting palpitations, they're not getting insomnia. If it's more physical-based as well as mental-emotional, then the Simvita usually shows up. And those two are wonderful in any of the cases where they're getting anxiety that is overdoing. And normal script is 5 drops 3 times a day. If they're having a bit of an acute problem, you can do up to 6 times a day. This one, if they're going to have problems with the anxiety stuff, often we'll see that they're waking up again in the middle of the night. Between 2 and 4 in the morning is the most common for some reason. Well, a variety of reasons. And I get them to take a dose of the Anxavita or Simvita then. And it often is enough to help them settle back. So, lots of fun and games. But the anxiety, especially in women. The guys, the Shivita 2 doesn't seem to trigger it. They get it in another one. The third chakra, liver, gallbladder, anger, frustration, heartburn, indigestion. Yeah, normal stuff. We talked a bit about that already. If you're using these remedies and you haven't studied TCM at all, if you look at because it really does explain a lot of what we see in there, is, we're talking about liver fire, we're talking about, kidney Qi deficient, these sorts of things. It's a good way to, if you study a little bit, it gives you a better understanding of some of the things we're seeing. Now, Shivita 4, the fourth chakra. This one, it shows up in two ways. One is you will see it show up sort of as an acute remedy if you having, a breakup, or you've had, a sudden stress on a relationship. And if that one's showing up and it's just sort of one set instead of two or three sets, we normally don't tend to get much in the way of any detox reactions at all. Where you get detox reactions in this one is in people where this is their central conflict, or, this is a really big, where they show up to 2 or 3 or occasionally even 4 sets of remedies that they need. And in those cases, this is a really deep-seated, chronic problem, and you're a little bit more likely to get anxiety. This is actually where a lot of the guys, and they think, oh my God, I'm having a heart attack. They start having, shortness of breath sort of anxiety. They get a little bit more acid refluxy symptoms. And often they get enormous amounts of sadness. This one is sort of the classic one for broken hearts. And that's what stirs up. And we get people who, they just feel really sad. And often they just need somebody to sit with them. Not necessarily talk to them too much, but just be there for them with this one. They just almost like they need somebody to hold their hand, or with the guys, kind of hard to do that. But they often just want to come in, and they often don't necessarily say anything. And you test to make sure they're not having a heart attack and they're not having too much acid reflux. But this one, it often stirs a real deep sense of sadness in some of the older men. They often, and in women too, it often will bring up, what have I done with my life? Why didn't I do the music that I said I was going to, and I became an accountant instead? And it is a significant emotional detox for that one. So a little bit of physical stuff, but that one, the biggest one I see is the emotional. So you need to talk to them. You need to do, send them to counseling if that's not a forte of yours, so that they can talk it out. Or just be with them sometimes. I know I have a problem sometimes is trying to fix it when they're experiencing these things. And sometimes it's just best to listen and not necessarily have to fix it. And that's one of the nice things with the remedies, is that they bring stuff up. And if you just sort of breathe through it, it's like doing yoga, it's like breathe through the posture. If you breathe through it, often you don't have to do a lot. If it's some physical stuff, you support it. And if it's significant emotional, you support it or send them for counseling or use some of the acute remedies. But often the patients need to know that it's a short-term phenomena. It's working on what's important for them. It's often good if you start talking to them, say, okay, have you ever felt this kind of stuff before? What was going on in the past when you were feeling this? What was, what was going on in your family, in your school, in your life? And often they will start saying, well, no, oh, yeah. And as you talk to them, they'll all of a sudden start looking back and remembering. And then just bringing that thing to consciousness, a lot of the anxiety, a lot of the other stuff starts to disappear. And that goes through all of them and saying, okay, when have you felt this angry before? When have you felt this, not wanting to be close to anybody before? When have you felt this oversensitive, overdone by everybody? It's just too much out there. And you'll often find that there were patterns and times in the past where this was a big deal, but they suppressed it. It wasn't appropriate. It wasn't, they weren't supposed to feel. They were supposed to just put up or do or whatever. So, Shivita 5. I love this one. This is a great one. This is one of the ones that shows up in an enormous number of patients. It's fifth chakra. Now if you put your hand under your chin, sort of around your Adam's apple, that's what it does. It can affect your teeth, so especially the bottom. I've had patients where, I've had that low level, TMJ. I've had that, that bottom molar on the left side. It's been on and off, and now all of a sudden it's kicking up. And you usually find it's a bad root canal or something that needed to be taken care of, but was sitting quiet and just once in a while, and it'll pop up. So these can also be good side effects, quote unquote, in that they allow you to identify potential festering spots that you need to have a look at. So, if that's the case, you look at it. If it's appropriate, send them to the dentist. And almost always they will find that there's a cracked tooth or a root canal that's gone on. So any of the symptoms that show up while you're doing this, look and see if the body's saying, okay, I didn't have enough energy before, but you've given me some juice. Now I'm going to wave a red flag and tell you that I need some help here. So they're good side effects. They're good detox reactions. But so look for the flags and tell them, the patients, that these are good things. These are telling us where we need to work. Biggest one is, the throat can ache, the thyroid will ache. This one will be very common in people who have eating disorders and, where they have trouble nurturing themselves. And so one of the symptoms is that they, get thyroid symptoms all of a sudden, or they get, their neck, you have to go to the chiropractor more often, or get some more physio, and just tighter out of the blue for no apparent reason. That's what that one is. But, so look for red flags when you're doing this. And this one, too, is great fun because I think this is my favorite one for women coming in saying, I started taking that remedy, and I went home and yelled at my husband. I haven't yelled at him forever. And my husband's totally freaked out. What have you done to me? And so the husband phoned me and said, what have you done to my partner? What have you done to my wife? And because unfortunately, for a number of women tend to be told to be quiet. And so this is a really good one. And so one of the side effects, quote unquote, is the patient or the woman, because it's often a woman, not putting up with stuff anymore and expressing themselves. And it's interesting because sometimes it's hard on relationships. I've heard some people call it the divorce one. But it's raising a red flag about the fact that, it wasn't working. It wasn't doing what it was supposed to do. So look for the physical things, but look for the red flags from an emotional level in that one. And, it's a really cool one. It's one, only has 2 Mvitas, but especially 17 is one of the most powerful, and almost everybody goes through that one. It's kind of interesting. Shivita 6, so 6th chakra, again a repeat sort of the Shivita 2. They're connected, of course. A lot of anxiety, so you can get some, in the chart it says sensation of pressure. Now this can be, sort of in your sinuses, in your ears, in your head. It also can be a sign of pressure, emotional pressure, where, they're feeling overdone. They're feeling that they can't, suddenly, all the stuff that they've been carrying around with them, all that stuff, the work, and looking after this and looking after that, the pressure suddenly gets too good, too much. And again, it's a warning sign of, I need to look at the level of stress in my life. I need to look at what's going on.